Good morning, and welcome back to Good Samaritan. By Adam Thacker, who took over last week in my absence, who's our Chief Operating Officer of Good Samaritan Hospital. We're going to be giving you our usual weekly update on kind of a situation of COVID in our community, our current numbers, issues on where we're at with testing, and then also an update on where we've been with our vaccination clinic, which was a big thing going on last week.
Yeah, a lot of success.
The numbers that we're going to update you on today are going to change a lot. If you've been looking at the dashboard as to what's been going on, things were looking pretty good. As of last week, numbers were coming down. But probably one of the most important things we're going to talk about today is the number of active cases in the community have jumped up dramatically. The hospital's been relatively full. We've had a lot of patients in and out of the hospital. But the number of active cases that we had tripled from 30 up to 90.
Right.
And it's important to realize that as we move into the fall months, we figured that this was going to be the issue anyway. We have talked in our past weeks with regards to the normal viral illnesses that come up at this time of year. The fact that we all kind of go back inside and we spread our little bugs and germs around, and unfortunately that becomes the case not just with our usual colds and flus and things like that, but COVID goes along with that as well. So as we march through the next several weeks and look at our numbers and our trends, it's important to realize that locally here our numbers have gotten worse. We have seen an increase in transmission, and it's very important that we all lock down and do a good job with regards to our normal precautions, with masking, with hand hygiene, and then of course probably the most important thing that sort of gets skipped over from time to time is the fact that if you are sick, do not go to work. Do not send your child to school. Make sure that you are getting evaluated, getting tested, finding out what's going on, seeing your providers and communicating about what's happening, because that is something we've done really good with over the course of the past few months or so, as people have done an excellent job in pulling themselves back out of work, keeping their kids safe, keeping their families safe, quarantining for a reasonable period of time. And we need to make sure that as we move forward, we continue to do well with that. Because as we've talked about in weeks past, the schools have done wonderful with that. So we want to continue on. Talking a little bit about percentages, about 10% positivity rate in those unique individuals, about 2% as far as overall. We've tested a little over 6,000 people and about 680 have been positive. But those numbers are going to be updated today, and that's going to change.
Yeah, anytime that we're reporting large numbers, such as the state dashboard, you're going to see a little bit of lag in reporting. And so as we come into Monday morning, every day at noon, 12:30ish, the state dashboard is updated. So there'll be a catch-up here today, and we're going to see that positivity rate change pretty significantly because of the active cases that we mentioned. And also if you're looking at the color coding, that blue, yellow, orange, red, as we mentioned last week and the week before, Southwest Indiana, Knox County had really been trending in the right direction towards blue, and we've been blue late last week and into this morning. But the rest of District 10 was orange, and we even had one county that was in the red. So we kind of expected this trend, and we're going to see the peaks and valleys with that as we move through the fall season. But we would expect that with the changes in the number of active cases, that we'll see that change as well to the yellow. And it just puts an increased heightened awareness of wearing our masks, following our hand hygiene, keeping those viral illnesses down, because we know that alcohol and social distancing are things that work in keeping that surfaces clean, keeping our hands clean, staying spread out as much as we can, especially when we move indoors. Masking is really, really important and something that we all have to be diligent about.
Another thing that has changed a lot is last week the vaccination clinic was up and running. Can you give us an update on that? Because that was a huge success and lots of volume.
So we've had 3 days so far with our drive-through flu clinic, a lot of success. First day, we did have a little bit of a traffic jam, but we were able to get that figured out. First year in doing this, we weren't sure what the volumes were going to be, but we have had over 350 individuals come through the clinic in those 3 days. First day, I think, was 160, and then we've been 100 plus each of the other 2 days. We have 2 days left this Tuesday and Wednesday, the 20th and 21st, 4:30 to 6:30. It's at our 6th Street Pavilion 6th Street awning, and we'll have everything set up to be able to drive through. Have 2 lanes and a number of folks working that. So, really happy to be able to offer that to the community. Have had really positive feedback on 2 things. One, being able to drive through, not have to come inside and and get the flu shot, as well as having Highdose available for our population that is 65 and older. Did have a few folks that came through for pediatric immunizations, and these drive-through clinics are for adult only. So this is 19 and over. There will be more information coming out about additional pediatric options, but Knox County Health Department Immunization Clinic, our family practice offices, our pediatric offices, all are able to provide that for their patients as well.
And this is absolutely the right time to be getting these. You know, we've been talking to people over the past month or so to get out and get your flu vaccine early. Well, now we're past the early point, and we're like, this is when the normal time is that most of us would encourage patients to get out and start getting their flu vaccine. There had been somewhat of a limitation on availability of the Highdose for a while. About a week or so, that started to become available in the community, also through our clinics as well. It's important to realize that Highdose is reserved for patients who are 65 and older. There's no value in us getting a Highdose. Most individuals, a normal dose flu vaccine is what's appropriate. But as we age, our immune response isn't as strong. And so the Highdose essentially stimulates a better immune response when you're over the age of 65. So we would really encourage anybody with those criteria that they should try to seek that out. Now, as we get further in the year, if for some reason there's a shortage of the Highdose, any flu vaccine is appropriate, but we would really like to try to get everybody over 65 vaccinated with the Highdose.
And you don't have to request that as you're going through our clinic. When they're performing the registration steps, they're asking age and taking all of that information and then automatically telling you that you qualify for that, and we'll go ahead and let the folks that are giving you the vaccine know to use the Highdose.
And the regular vaccine administration is continuing to go on through all the rest of our normal clinics. So as you go to your primary care offices, be that pediatrics, family medicine, internal medicine, any of those clinics have a flu vaccine available at this time. Health department has it available also, and then also our retail clinics around have that vaccine available. So there's lots of potential places where you can get the vaccine, but we would encourage people to get out, get vaccinated now. And this year more than any other, it's important to make sure you get your flu vaccine because it's one other thing that will potentially produce symptoms that are very similar to COVID. As we move forward, we know that looking back to March when we were coming out of flu season and coming into COVID season, unfortunately, that there was a lot of overlap in symptoms. And patients ask us frequently what the difference is in that presentation. Early on, it's very difficult to tell. The flu seems to be much more rapid onset. Symptoms seem to be more severe earlier than what the symptoms are with COVID. But one of the things that we've certainly learned about COVID in the last 6-7 months or so is that the symptoms are extremely variable, from something as simple as no symptoms at all to something as severe as acute onset of respiratory symptoms, upper and lower respiratory symptoms. So it's important to realize that if you have any questions as you're becoming ill or developing symptoms, please contact your providers, get information, get evaluated, determine whether you need to be seen in person or whether a virtual visit would work, and we'll help you navigate through that.
And maybe one last push on the flu vaccine is we know year over year we see anywhere from 20% to 60% accuracy because there is somewhat of a guess of what virus it will be with the flu. But even if you get the flu vaccine, even if you do get the flu, we notice that there's typically a better immune response and a less acute illness from the flu virus. So rather than being sick for a week, it may be a couple of days or even asymptomatic. So there is still benefit in getting the vaccine, even if there's not 100% protectivity, because we know that that's not going to be the case.
Yeah. And it's something that we can test for and separate out who has flu versus COVID relatively quickly. And thankfully, we have very effective treatments with regards to influenza. But the key is getting that diagnosis early. So a lot of times people are used to waiting things out, which is typically fine. This year and this season, not as great of an idea. We want people to get evaluated early to determine if that's what it is, because the treatment for the influenza is very dependent upon how long it's been since onset of symptoms. If we look at the first day versus the second day versus the third day, the efficacy of those treatments goes down exponentially once we get past about the third day. So really getting evaluated within the first couple days of those symptom presentation is what's recommended. Update on testing. So testing continues. We're still doing nasopharyngeal swab testing on the adult population. And NARIS testing on the pediatric population. Can you talk a little bit about in the community as to what testing is being done where and roughly what our turnaround time is right now?
So our two main test sites from an ambulatory standpoint remain open at Convenient Care and at our medical center at Vincennes. We're also testing, of course, here at the hospital for folks coming in through the emergency department or being admitted. The majority of testing, as we've talked about, is happening in the ambulatory because the majority of patients don't require the acuity of care of being in the hospital. So convenient care out of Willow Plaza, Medical Center of Vincennes. You'll be assessed by a provider. Ages 12 and under getting the NARES swabbing. 13 and over will get the nasopharyngeal, which is the longer swab. And we're seeing 2 to 3 day turnaround time as we're sending those off. And that's pretty common as to what we're seeing really across the nation. Actually, our turnaround times are better than what the national averages are. We are able to do rapid testing in-house for our patients that are in the hospital, and quick decision-making really is important. But in the ambulatory space, if you're symptomatic and being tested, you should be home quarantined. Or if you're a direct exposure to somebody who has tested positive, you should be at home quarantining for up to 14 days. And really the test result is irrelevant in changing that direction. If you've been a direct exposure or are symptomatic, then that 2 to 3 day turnaround time, I know everybody wants to know, and we all want instant knowledge as to what the result is, but it doesn't change the course of clinical treatment, which we've talked about really since March.
As Adam said, the majority of patients who get this illness will be taking care of themselves in their own home, convalescing at home. Recovery is relatively simple, but we have seen an increase in the number of patients admitted to the hospital. The hospital has been busier, more full. We've had more intensive care patients as well. So could you talk for just a moment a little bit about what our visitation policy is now and what we've done over the course of the past several weeks?
So currently our visitation policy stays the same as it has been over the last few weeks, which is one visitor is allowed with really across any aspect of care, whether that's a medical office visit in an ambulatory space, coming in for tests such as radiology or lab, up to inpatient. And patients that are going to surgery and then becoming inpatient or in the hospital can have one visitor. Our visitation times are 10A to 6P. And there are some exceptions to that. If we have a pediatric patient, they can have 2 visitors. If we have folks that are at the end of life, thinking hospice or are imminent that they're going to pass away, then there's some loosening of those guidelines to allow family to be part of the care. Along with those in-person visitation, we have a number of avenues that we're trying to stay in communication with the family while still allowing our team to take care of the patient in front of them as much as possible. So we have daily communication with COVID positive patient families that have a designated care provider once a day from the provider team, whether that's the hospitalist or a physician or maybe one of our medical residents. And then the nursing team is communicating as well. And then certainly any change of status. If a patient was being moved to, let's say, an ICU level of care, or there was a decision to be made about a procedure, then communication happens at that time. And then the last piece for our ICU population, we have started performing what are called window visits, which is an escorted visit, if you will, for a family member coming in that may have a loved one that is COVID positive, possibly on a ventilator, being able to come and see them, talk to the care team, and get an idea of what's going on and what the plan is. Again, there's a lot of factors being balanced with visitation. Not of the least is that if we have COVID positive patients, the more people going in the room, the more risk it is that somebody else may contract COVID and then become ill. But also our team focused on the patient in front of them and taking care of them while trying to keep the family in the know as much as possible. And we've had really good feedback since we have updated our visitation and communication plans.
Probably one of the most important things that you mentioned is that designated care provider.
Yes.
It's making sure that the family member who's in the hospital who is ill has one primary contact that we talk to and that the care team talks to make sure that they're updated, and then that person can dispense that information to the rest of the family. But that is super important. That's something that we always recommend when somebody's in the hospital, but it's becoming increasingly important as our COVID epidemic has progressed. So make sure that you have a designated family member who is that contact person, because all the providers, the nursing staff, everybody else is going to use that person to disperse that information. Yeah. Any other information for folks this week before we go to the phones?
No, I don't think so. Let's see what questions we have.
So I have one question right now that you kind of touched on, but I want you to kind of repeat it. If someone has taken a COVID-19 test because they've been exposed, should they quarantine, although no fever or symptoms, while waiting on the test results?
Yes. So two parts. Anytime you have been tested for COVID-19, a pending test has to be assumed positive. So while that test is pending, absolutely should be quarantined. Now, the direct exposure piece, per CDC guidelines, if you've been contacted by what's called contact tracing by our health department, or if you were tested outside of the county and have been contacted by the state from a contact tracing, and they say based off of that less than 6 feet, more than 15 minutes, no masking, you're considered a direct exposure. The CDC guidance is that you should be quarantined for 14 days. The reason for that is based off of testing. Testing identifies the virus, and there has to be a viral load that is large enough that that nasopharyngeal area has the virus and that we're testing for it. So when you hear of false negatives, a lot of times that's not that the test is inaccurate, because we know if the virus is there 99% of the time, we're going to identify the virus. But you may have been tested and just not created the response that was necessary to test positive, and that could happen later. So that's been identified as 2 to 14 days, and that's why if you are identified as a direct exposure, you should have 14 days quarantine regardless of test. Even if you come back with a negative test, if you don't get tested or you test positive, it's all the same.
And it's important to realize, too, that during that period of time, let's say that you're exposed, you had a direct exposure to someone that was positive, and you go into your 14-day quarantine. If you become symptomatic during that 14 days, the clock unfortunately resets at the time that
Correct.
you become positive. So what Adam is talking about is we need that 14 days to know if you're going to become symptomatic. And then during that period of time, if you become symptomatic, then you go into the 10-day isolation period for being either a presumed positive or a tested positive. One of the other things that's very important to think about, too, is we have people who have been positive in the past that then are requesting to be tested again after they have, quote, recovered. It's important to realize, just like Adam was saying, that the viral particles that we are looking for, the test is excellent at identifying those. The problem is the dead viral particles are still around even after you have recovered, and so they can be presumably detected, and that test report is positive. So being tested a week or 2 weeks or 4 weeks or 6 weeks or even longer after you have been positive and then recovered, there's really not a lot of utility in that. Right. And so that's one of the things that we're working with our local employers and schools and other individuals to understand, that testing somebody to be negative before returning back to work really doesn't help us as much as saying you were positive, you went into isolation for a recommended period of time, you recovered, and now you're safe to return.
Right. Yeah, the most recent recommendation was up to 90 days that you could continue to test positive after contracting the virus. So it's really about that symptom management, working with the health department, your employer, and even if you have tested positive, once you've recovered and are considered no longer shedding virus and contagious, then you can return to normal activity.
Yeah. And just a qualification on the if you've been tested, you're presumed positive. There are a few asterisks to that, which would be if you are going to go to have a surgery done and you're required to have a test done prior to that. Those types of things don't count for that. If you're getting ready to travel and you have to be tested for that as well, you're not a presumed positive under those circumstances. But everything else that Adam alluded to is important to realize that if you're being tested, generally you're being tested for a reason. Either you had symptoms or you had a potential contact. But if you're being required to do that for travel reasons or for other reasons related to that, then that's out of that realm.
If you are in a room with someone who is positive, should you be concerned, even if you aren't close to them?
How big is the room?
Yeah, I think one of the phrases that I've heard a lot is out of an abundance of caution. So people get tested out of an abundance of caution or quarantine out of an abundance of caution. Every situation is different, and there's a lot of factors to that statement. So the size of the room, how much people were moving around and the surfaces that were being touched, what type of interaction there was it a lot of talking, was there somebody speaking to where the louder you talk, and we know singing, very early on there was a choir and singing, and you're going to expel the virus. So just going back to the very early stages, this virus is contracted through droplets, which is we're talking, and then those viruses are entering our bodies through any of our surfaces, our eyes, our nose, our mouth. So I would say that the short answer is yes, you should heavily monitor your symptoms and consider if quarantining for at least a short period of time is possible in your situation. But again, a lot of factors play into that as far as size of the room and how much people are moving around.
And going back to masking continues to be the best thing that we are doing, along with hand hygiene and general universal precautions. I still get questions every day as to why we're masking, and it's because masking works. And it's important to realize that, if we just look within our own healthcare system here, we have been masking since very early on in this process, and it works. And we know that because of the very, very few people that we have seen that have been around COVID positive patients that have come back positive or developed any symptoms. We've been very fortunate in that manner, and I think it's because people have been very vigilant about using their masks. We are no different outside of the hospital setting than we are in the hospital setting, to realize that using your masks and social distancing and being very cognizant of that is important. And since we went back to the universal masking throughout our communities, we have seen that has been very effective. What everyone is concerned of locally and regionally and nationally is that we have softened up at other events, meaning family events and group gatherings and things like that. And that's important to realize that we can't back off on that.
Yeah, and with the mask, I think it's important to note that, similar to we mentioned the flu vaccine and the accuracy of masks they're not 100%, but when we talk about that viral load, we know that it decreases the viral load. So if you do contract coronavirus and you're in a majority masking event, if you get a low number of particles, your immune system can respond before that viral load really builds up. If you get hit with a high viral load right out of the gate, then the virus acts faster than your immune system, and you have a higher, propensity for an acute illness. So if nothing else, it is just making where your body has more time to respond.
And that's one of the things that we've seen throughout the course of this is the mystery of why does one person get sick versus another person get sick. And the majority of people we know are reducing that risk by wearing their masks and social distancing. And as a result, generally are recovering in the ambulatory world quite successfully. The problem is we are seeing more people getting infected and therefore more people being admitted to the hospital. But I think it's important to realize that at no point have we really been overrun by the surge that we were worried about back in March. If we look at where we were then and what we were worried about, even though we've seen a larger patient volume coming into the hospital over the course of the last few weeks or so, we've been fine with regards to ventilator utilization, ICU bed utilization. Hospital's been full. We've been very busy. But regardless of that, the important thing to realize is not just locally, but regionally, we've been very fortunate that our resources have not been overtaxed.
Yeah, and those are the two main resources that we look at: ventilator capacity, ICU capacity. And as Dr. Stine mentioned, here locally, we remain very confident in our capacity to take care of the communities that we serve. We work within our District 10 region, which goes from us up towards Terre Haute down towards Evansville. And then on a statewide capacity standpoint, also, you can see those on the dashboard and see where we sit. And even if there is a uptick in utilization, our overall resources remain very strong. One thing that we also talk about with resource availability is also treatment. And convalescence plasma, remdesivir have been the two big ones. We have those. We're treating patients with those. And ultimately, those help to fight the virus and boost our immune system. And some new agents are coming out that help to boost the immune system, which again allows your own body to fight the virus.
And the key with that is also getting that identified early.
Right.
So when we talk to patients and are trying to triage them in terms of the severity of their symptoms, as they transition into the hospital setting from the ambulatory world, the importance of getting that diagnosis determined as quickly as possible is important. You had mentioned the importance of those rapid tests that we have, and that's really when those come into play, is when those patients get admitted to the hospital and we're concerned about them having that as the source of their infection. They get tested in a rapid nature in the hospital, and then those modalities of treatment are brought to play.
This question, not exactly sure what she's asking. What about people that are considered essential workers? Are they allowed to go back to work? So I'm assuming she means after a negative test.
Sure. So the first response is it's dependent upon your employer's definition of essential and what that looks like. So I can speak a little bit to Good Samaritan, but working with your employer. So from a Good Samaritan standpoint, we have policies that we've put in place for essential workers that are taking care of patients. If somebody is symptomatic out of that that abundance of caution. If we have the resources available, then they are going to be off while they recover from whatever illness that may be, whether it's coronavirus or this has been in place for flu seasons since inception of really seeing flu from a seasonality standpoint. So we do monitor that. We utilize our employee health team, our infection prevention team. We work with Dr. Stewart. Outside of Good Samaritan, that would be my main recommendation is your employer policies on essential health worker or on essential workers, and then working with Dr. Stewart to identify what the need is. We have a number of employees that are working remotely, or we take action to keep their interactions with individuals down if they are working. And again, masking is really important in that regard as far as essential workers. But first and foremost, if somebody is ill, is symptomatic, then we want to keep them at home recovering so they can get back to work at 100% rather than somebody working ill.
And it's being handled very similarly with regards to our police forces, our firefighters, so forth, is looking at those numbers, looking at what kind of coverage that they have, and again, using the phrase used earlier, an abundance of caution, if at all possible, to pull those people out of service. But we are able to look at that also critically and say, if the need becomes necessary, that we're going to bring people back in, but in a safe manner. I think that's what she's getting at.
And patients with CHF, COPD, needing surgery, all of the other treatments that we have provided for 100 years has not went away. So this is on top of that. So having a healthcare team present and able to take care of everybody with their needs is our priority. So we put as much safety precaution around that as we can.
Okay, that wraps up all the questions.
All right.
Thank you all very much for being with us this week. Adam and I will be back with you in a week as well. And please submit any further questions you have, and we'll try to address those throughout the day. Thanks.
Thank you.